It's 10:30 in the morning, and I'd like to call to order the teleconference meeting of the Rules Policy and Industrial Relations Committee of Thursday, February 24th, 2022. Before we begin, please everyone be advised that this meeting is being recorded. Madam Secretary, can you please call the roll?
Thank you. Starting with Director Cochran.
Here.
Thank you. Director Conroy. Absent. Director Garbarino.
Here.
Director Grosball is absent. Director Hill.
Here.
Thank you. Vice Chair Arnold is absent. Chair Hernandez.
Here.
Thank you. And President Terrio.
Here.
Thank you. That confirms you have a quorum. Also on the line, we have Directors Maston, Parr, Rabbit, Radoni, Snyder, and Thayer. So you are a committee of the whole. Staff on the line, Dennis Mulligan.
Here.
Joe Wire.
Yes.
Thank you. Ava Bauer-Furbish.
Present.
Thank you. Dave Rivera.
Good morning, President.
Mona Babauta.
Present.
Thanks. Jim Swindler. Not here. Kelly Hopper.
Present.
Thank you. And Madeline Chen, let me confirm you're here.
Yes. Thank you.
Thank you. Sorry about that. And also on the line, we have Kelly Vitale. And that confirms everyone on the line. Thank you.
Thank you very much, Madam Secretary. I'd like to remind everyone to please mute their phones until after staff's presentation, and remember to unmute and identify yourself when you have a comment for discussion. If there are any comments or questions, I will call on you accordingly. And following our discussion, we will ask for any public comment before moving on. Please follow along by referring to the page numbers located on the bottom right-hand corner of your meeting packet. Madam Secretary, we're ready to proceed with the agenda. Thank you.
Thank you, Chair Hernandez. We're going to start with item number 3, which is a presentation by Kelly Vitale on the district's 2022 on-site occupational injury prevention, health and wellness program. The slides for this presentation begins on page 3 of your meeting packet. And Kelly, go ahead and begin your report to the committee.
Good morning, everyone. Thanks for having me this morning. I'm bringing you the presentation forward today because in our meeting in December, there were questions asked specifically about what we might be doing to improve the health and welfare of all of our employees, but most significantly, the bus operations. And so today, this presentation that begins on page 3 will just give you a highlight overview of what Pivot, our on-site clinic, will be providing and what it's started and where it's expected to go. And so I'll begin on page 4. And what this program is premised about is ergonomics, and what we all might think about ergonomics is probably, is my desk centered? Is my chair the right height? Am I sitting correctly? But actually what Pivot's on-site ergonomic program is based on, or it's predicated on, is a proactive state, and it starts with leading and creating programs and teams. So in and out of the bus, sitting at your workstations, perhaps maybe, while you're sitting or walking up and down stairs. So first they look at all of the different job functions and functionalities, and they then create some risk analysis or essential functions. And they've done that they did that for Bridge, and they also did that for Ferry. Bus operations has been done recently, and so they do have access to all of those essential function descriptions. So they use that in coordination with HR, and then they create and develop what we call stretch and flex, and in the PowerPoint here it's called a pre-warm-up and conditioning. And so that's actually going to begin, the stretch and flex will be beginning on March 1st. It was pushed back because of the surge that we had in COVID cases thanks to the Omicron, and we had some outbreaks. And so we had to be mindful of those restrictions that we had in place. And so now the stretch and flex and the warm-ups and conditionings will be beginning on March 1st. Along with those, they're also going to be including some healthy meal alternatives. They'll be also working in tandem with the wellness committee at the district announcing this information. the biomechanical assessments that they do, this is really specifically related to what happens when you're sitting in a bus or when you are sitting all day. And it's specifically related to your lower back, your legs, your ankles, your feet. And it's just an assessment of those areas and the trigger points that could cause pain. And so the idea here is to make folks aware of where these trigger points are and how to improve them, and then to implement these warm-ups, conditioning, stretch and flex, so that it just becomes a regular routine part of folks' days. There's also interactive job coaching, and that's more just morale boosting, improving mindset, something as simple as teaching folks to just really be aware of their breath and take deep breaths. And as cliche as that might sound, it really is impactful, and we're hopeful that if we continue to send that message to the employees, that perhaps maybe it'll even reach just a small percentage of them, and that will make a difference. We are already tracking our ergonomic performances and injury trends. We are sharing that information with Pivot so that when we have injuries that occur, and my environmental health and safety staff takes a look at those and works with BUS and or the other departments on those injuries, they then share that information with Pivot so that way when Pivot is doing these stretch and flex or conducting their assessment, they're aware of some of the tracking of injuries that have occurred. They're also, and that kind of ties in actually to the next item, which is the collaboration and intervention. And so a lot of times with injury prevention, it's really more reactive. You can try to do as much as you can proactively. Each person moves and works differently. And so what we're trying to do is create an intervention and plan so that we can protect the workspace and the employee and change the way the employees work, remove them from hazards, substitute those hazards if we can, and or eliminate and physically remove the hazard if it's necessary. And so that's the hierarchy that's involved with ergonomic controls. And then engaging the staff, right? All of this is great, and we can put all this out there, but we have to get folks engaged. And so that's why we're trying multiple prongs, through wellness teaching, through stretch and flex, through food options, and just information and education about that. And so we're hopeful that bringing all this educational information in, introducing some of the programs like a back school, the obstacle courses maybe, and or the assessor courses where employees can actually identify if there are dangers that they know about. All of these things we hope will engage our employees to prevent future injuries and just to overall keep them safer. On page 5, the Pivot program employs an athletic trainer, and so we have a PA, a physician's assistant, a medical assistant, and an athletic trainer on site. This is for district-wide. The trailer is currently located in San Rafael, really right behind the bus shop, and so that's where the majority of the use is at the San Rafael location, but it is open to everybody. And we hope to extend it out to Bridge and Ferry. And I have asked Pivot to make a concerted effort within the first quarter to at least get out to Bridge and Ferry at least once a month, introduce themselves, and so I've given them the information. I know that they have been at Ferry. They have not yet been out to Bridge, but that is our goal, to get them out there to meet with Dave and to let folks know the things that are available to them. And at the end of the presentation, you'll see that there's a QR code that any employee can scan and have access to the information and when the classes or programs are available. So back to page 5, and this just gives you a schedule of what the athletic trainers program looks like. And so we are, again, the March, April ergo job risk assessment is actually moved down. And that's because our job shadowing and our stretch and flex is actually beginning March 1st. And again, that's just because of the outbreak, and we have to be mindful of that. And so every 2 months, Pivot will introduce one of these programs, or 2 of them at a time actually. And then they report back to me monthly, and we continue, we revisit, we revise, just based on the feedback and how things seem to be trending. And so that takes us to page 6. And this just shows you how, or gives you an example. It's kind of small. They're actually laminated cards that folks will be able to hold and see, where we ask them to create some poster size so that we can put them up in the break rooms. And so these are just an example of some of the dynamic warm-ups and some of that stretch and flex that I mentioned earlier to you. And it can be site or division specific because, not every position does the same thing. But we do know across the board is that back injuries, sprains and strains are our most common injury. And so that will be, those type of stretch and flex and warm-ups will be prevalent amongst all of the district, all the divisions. But you'll see that they offer neck rolls, neck stretching, and shoulder rolls. And that's important whether you're driving a bus or you're sitting at a desk. Whether you're wrenching some tires off of a bus or, you're working dispatch all day. I know from sitting at the computer, if I don't move, right, I'll have, my neck will get really stiff. And so, again, these are just really essential they can cross just about any job within the district. They also include, your shoulders on the second one, and which includes your traps and your scapula. Again, that's all again tied to your neck. And the stress that the operators induce because of their positions and, having to look and monitor for traffic and folks getting on the bus, this is a really critical one. Next to their low back, their neck and shoulders are the number 2 area of injury for the employees. And then, almost as important is the legs, and they talk about it here in the leg balance and calf stretches. But, just like when you're sitting on an airplane, right, they say if your flight's going to be more than 2 hours, you have to get up and move around just because you need to keep, the blood flowing in your legs. And so that's why the calf raises and stretches are also as important. And so, again, these are just an example sampling of the Stretch and Flex program that they'll be introducing on March 1st. And I'm excited to see the employees that choose to get along and to participate rather, and that the more will come along once they see others doing it. And I think just having it constantly present will help some folks. Maybe they won't participate while it's happening, but maybe they'll be mindful of the posters that they see, and maybe they'll try it at home or outside in the patio or something. But we just hope that repetition makes it stick and makes them mindful of it. And then on page 7, the athletic trainer prevention program is it's a mimic of what you saw on page 5, talking about what their plans are for the year. But what this does is it just breaks it down in phases to show you that beginning in March they'll be doing some job shadowing, and so that's really critical, right? It's important for us to know that our job descriptions or essential functions are accurate and that we are really acutely aware of what the employers are doing. So they'll pick like the top, 3 to 5 categories of occupations that we have injuries in, and then they'll job shadow those. And that's going to start in bus operations, and then they'll start the stretch and flexes based on that. And then phase 2, again, talks about that biomechanics assessment, where they really concentrate on the lower limbs, the back, the legs, the calf, the feet. And then they will implement in the prevention plans, and that's where they get folks involved, if they see danger, if you see something, say something, and just hoping to bring some engagement to the process. And then, just continuing at phase 4, and then that's where they look to see what was most critical, what was most effective, and then go back and, revamp it or start it over again in that same type of cycle. And on page 8, what you'll see is that aside from these wellness programs, what we brought to you for approval last year with Pivot was so that they could make things available to the district that had been really far-reaching in some instances, because we had to send employees out to get drug tests. We had to send employees to get, pre-employment physicals. There were things that we had to do that weren't available to us or that were costly or place time constraints on our folks. And so what Pivot did here on page 8 was they just gave us a sampling of some of the things that they offer to the district aside from the wellness and ergonomic and athletic programs. And that is that they can provide first aid care, and first aid is defined as, not needing medical attention, maybe just not needing to go to the doctor, but, maybe a bandage or some first aid cream or something like that. and of course the wellness and the prevention promotion events. They do some biometric screening. They also can offer chronic disease management, so that if there is stress, mental health, substance abuse, they offer all sorts of resources for that. They offer lunch and learns. They have participated in our health fairs, and they can also provide assistance for FEMLA and disability management. Aside from the drug testing, the pre-employment physicals, they also provide Hep B vaccines for us. They assist wherever we need it medically, and so it's just been a really great partnership. And so this is just a really small sample of some of the things that they can provide for the district, aside from what they're already offering. And then on page 9, that just gives you a small snapshot of kind of what we've already seen on the previous pages, and it's just their health and wellness calendar, and it's an outline of it. And this is something that the Wellness Committee is going to be sending out when they send out their wellness notice. Just as a reminder to folks that it's available. They'll also have these flyers available in the pivot trailer, and when they do their stretch and flex, they'll also be handing these out as well, along with what you'll see on the next page, on page 10, and that is the QR code that I was telling you about. That makes it a little easier for our employees who are on the go, or maybe not in a break room, or haven't seen a poster, or didn't get a flyer, or don't check email. What they can do is we can share this QR code with them, and it will be available on the posters, as I mentioned previously, and handouts and in emails. And they can scan this code, and it just gives them the monthly update. So it tells them what's happening, when it's happening. If we're going to cover healthy snacks, then we're going to do lower limb stretch and flexings on Tuesday. And if we're going to have mental health awareness next Friday, that QR code, scanning that gives the employee all of that information. And so I thought it was great for them to provide an alternative option to communicate with the employees, so that we're making sure we're touching as many of them as possible. And so this final page again on page 10 just talks about the occupational services and then the wellness services that Pivot provides. And I've been over them, but I'll just remind you that they do offer not only that injury triage, but because they have that athletic trainer, they can provide a physical therapy. And so for our employees that may have a workers' comp injury and may be assigned for, a couple of visits of physical therapy, instead of having to give them, 4 hours off to go attend and come back, we can now offer them physical therapy at the Pivot trailer in San Rafael. Of course, it has to be scheduled, right, so that we have enough tables available. And so that's a great benefit for the district as well, because again, we were losing productivity and time, whereas now somebody has a physical therapy on a work-related injury, and they coordinate it with the Pivot location and Karen Buchanan, then we can save up to 3 hours, because the physical therapy is usually never longer than an hour, and it's going to be right there on site. So that's a great value add for the district employees. And they can, because there is an athletic trainer and because there is a PA, they can provide emergency medical response if needed. Of course, naturally, we always recommend that they call 911 if that's the case, but if there is something that arises, they are on staff. We just want to make sure that everybody knows that they can contact Pivot. Their information is available here at the bottom of the slide 10. And so we urge everyone to become familiar with them, contact them, drop in, say hello, give them a call, send them an email, set up a visit. It's just a really great value add for the district, and I just couldn't be more pleased with the partnership. And so that concludes my presentation about the Pivot offerings. Are there any questions?
Thank you, Kelly, for your presentation. Hi, this is Director Hernandez. Thank you very much, Kelly, for your presentation. I'm very excited about the program. I'm just going to make a few comments and then open it up for questions. First, the Pivot trailer that's on site, you mentioned that there's going to be physical therapy available there, and a trainer, an actual person to assist in those kinds of efforts. Can you please just, these services are available in addition to perhaps other treatments that our employees may be receiving through their private health insurance. Is that correct? By no means does this preclude the availability of use of private insurance for treatment outside the office. Is that correct?
So the physical therapy is related to workers' comp injuries. And so if the employee has a work-related injury and they were given a prescription for physical therapy, they can go to whomever their provider tells them to. We're offering them the option to get it done at San Rafael so that they don't have to travel. Some of them have to travel great distances to get their physical therapy, oftentimes taking the day off or at least half a day off. And so having this available to them as an option saves not only the district's time and productivity, but it also gives the employee, a really great option to just walk over to the trailer and get their physical therapy versus, driving for an hour to go get it.
Okay, and these individuals they have all of the licensing and everything that you would expect from a private,
Yes.
from someone who's treating you in private. Okay.
Yes,
All
the
right.
athletic trainer is a licensed physical therapist. Does that answer your question?
Correct. Yes.
I'm sorry, I didn't mention that previously, so I apologize for not mentioning. But yes, he is actually a licensed physical therapist and an athletic trainer. I omitted mentioning that part. Thank you for catching that.
Oh, no, that's okay. And I said that I was going to make a few comments and then ask some questions. I'm just going to hold back for the moment, and I'm going to open it up for questions from other directors, and I'll make some comments later. Thank you. Any directors have comments on the presentation?
This is Director Hill.
Director Hill, please go ahead.
Yes, I am so excited about this. This is such a good investment because our employees are actually spending about over half of their working time, with the bridge, with us. And it has such a big effect on health. And I'm glad that it was comprehensive enough that you're addressing the entire part of investment. It certainly, just from a pure money standpoint, is likely to be a very good payback. But more than that, I think understanding these things and working on them and working with them is such an incredible investment. And I can't tell you how much I think this is just really, really good. So thank you very much for this report.
Thank you.
Thank you, Director Hill. Any other questions or comments? Okay, well, hearing none, I'm just going to make my comments then, and I suppose I'm going to repeat what Director Hill just said. I know that the district over decades has been making efforts to improve the experience to our employees, make sure that their environments are safe. Certainly, it's important for our employees to come to a safe environment and not be injured at the end of the day. And it's good for the district to have healthy employees that are coming to work and being able to perform their jobs. I know that we've tried different things over the years, and there's been a consistent effort actually. I think primarily sort of spearheaded by our chief of the DBE program, Tima Davenport, to help put together health fairs and do physical activity challenges and efforts and activities focused on nutrition. But this seems like it's a very comprehensive program with outside staff that will manage everything. And I'm sure that Tima would appreciate some additional extra hours to do the 75 other jobs that she does for the district. So, yeah, looking forward to the rolling out of this project, and wondering what your plans are, Kelly, to report on the progress of this in the future. Thank you.
Thank you for the feedback. I can provide, biannual or annual, whichever the board prefers. I, often have to bring things forward to you, so I can just add this on the list to, bring it biannually as I do with the workers' comp information. So it's you guys just tell me how often you want to hear about it, and I will keep you updated.
I think it would be great to stay in touch on this program, and perhaps an annual report would be good.
Perfect.
As long as staff and Dennis is okay with that.
Yep.
Sounds great.
Wonderful. Last chance for questions or comments. Okay, hearing none, this concludes the discussion on this item. I'll just say thank you again very much to Kelly. Looking forward to how this program rolls out and how it will benefit both our employees and the district as a whole. Madam Secretary, is there anyone from the public wishing to speak on this item?
We have no speakers on this item.
No speakers, thank you. There's no action required on this informational report, and so that takes us to item number 4, which is public comment. Is there anyone from the public wishing to address this committee on any other item?
We have no members of the public wishing to address the committee.
Okay, thank you very much, Madam Secretary. That brings us to the end of the agenda. So may I have a motion to adjourn this meeting?
I'll move.
Okay,
Okay.
got it.
All right, sounds like we have a motion and a second. Was that correct, Madam Secretary?
That's correct.
Okay, are there any objections to concluding this meeting? Hearing no objections, this concludes this meeting of the Rules Policy and Industrial Relations Committee. Thank you very much to our presenters. Thank you, colleagues. And the time is currently 10:56.